What up, though?
I got to talk. I got to tell what I feel. I got to talk about my life as I see it.
All right, then. It's time for you to bring it to the table.
Turn up your radio wherever you at. We about to bring it.
Street Beat.
Yeah.
With Tony B.
For the next hour, Tony B will give you a chance to tackle local, national, and international issues that affect your community.
Street Beat. Street Beat. Tony.
Welcome to Street Beat. It's me, Tony B. This is Earth Week. Here at Rainier Avenue Radio, we are celebrating Earth Deserves More Than a Day. Now, Earth Day is April 22nd, this Saturday. But all week long, right here on Rainier Avenue Radio, as you well know, started yesterday on Monday, and then again today, and then again Wednesday, and then Thursday, and then Friday. All week long, we're going to be celebrating Mother Earth. Well, we'll be having workshops and panel discussions and kitchen table conversations. And Thursday, we've got a youth advocate takeover day to discuss environmental justice and climate justice right here on Rainier Avenue Radio. So if you're watching, you can actually come down to Columbia City Theater as well and participate in some of the discussions and networking that's going on down here. Yesterday, we had a really good kickoff to this whole event, and yesterday we had the South Sound Connections here, and Nurturing Roots joined us as well. We had kitchen table discussions, and of course we showed short films, which we're going to continue to do. Today, I'm excited that Seattle King County Public Health Officer Jeffrey Duchin is joining us. Jeffrey, how are you, man?
Tony, it's so good to see you again. It's been a while. I'm doing well. Yeah. How are you?
Well, under the circumstances, I'm doing fantastic. Those of you who say, "Well, wait a minute, this is the COVID guy." We appreciate you coming on and keeping us, at the time in particular, keeping us abreast of what was going on with COVID and in our communities and nationally, and what we could do. I don't want to say that time has passed, because that's not the case. We are going to be talking about, again, don't let me put words in your mouth, but climate justice and climate change being a public health issue. Absolutely. Right? Am I right about that?
Absolutely. I mean, if you look at the World Health Organization considers climate change the single biggest health threat facing humanity.
Wow.
And here in the U.S. and around the world, public health, healthcare, environmental health organizations all recognize climate change as a real health emergency. So you're right on. Public health is a health issue.
Well, we're going to talk about
climate change. Is a health issue.
We're going to talk about that. But since I have you here, I want to sneak in a COVID update.
Okay.
Where are we at with COVID? We know that we had vaccines. Folks are now going to the hospital and getting some kind of medication that hopefully lessens the symptoms and gets folks feeling better. But it's still out there, right? It's still out there.
Absolutely. We're not seeing the big waves like we saw of the winter of 2021, winter of 2022. But the water hasn't receded. We're still walking around with water level up to our knees. The trough is still high. So although the big peaks aren't happening, at least at the moment, which is great, we still have a significant amount of COVID that's still out there. And if you're a high risk person, in particular like me, if you're 65 or older, or you've got some underlying health conditions, it's still critically important to do what you can to decrease your risk, which means, getting vaccinated if you're not, or being boosted. And that booster is really important. I know people, haven't really been as excited about the booster as they were about the first series of vaccines, but that booster really ups your protection against hospitalization and death. And then also just knowing what you said, Tony, there's treatments out there that can save your life and keep you out of the hospital. So if you think you've got COVID, if you've been exposed, it still makes a lot of sense to get tested. And if you're a high-risk person, you can get that treatment with Paxlovid, and that can really make a world of difference in how well you do. And of course, even though the majority of people who get COVID get mild or not hospitalized or not fatal infections, there's still a lot we don't know about the long-term effects of this virus. It causes an increase in risk for lots of other conditions like heart attacks and strokes, neurological disease. And so it's really good to try and avoid this virus as much as you can, even though people are getting more comfortable going back to their pre-COVID ways of doing things, taking precautions, particularly if you're high risk. And you don't want to get this virus again and again at this point, especially since we don't know what those long-term complications are. So I would say it's still out there. It's not off the wall high surges like we saw, but those can recur. We just don't know. And the safest thing you can do to protect yourself is, be up to date with your booster dose. You try and be careful about crowded situations. Mask if you're a high-risk person still. I do in the grocery store when I'm around others in crowded places. And get treatment early if you're infected.
Okay. And so boosters are essentially, it's the vaccine. It's just a booster. And that is something, correct me if I'm wrong, that for the foreseeable future is going to become part of what is suggested to prevent COVID. Is that accurate, or is that something we're going to keep doing?
People are talking about the possibility that there'll be an annual booster recommended or an annual vaccination like flu is currently. We know influenza kills a lot of people, hospitalizes a lot, and makes a lot of people miss work every year. And for that reason, we take annual influenza shot. It's quite likely that there will be a recommendation for at least for adults and high-risk people to have at least an annual shot. That probably will be decided in the next couple of months. Right now, the recommendation is that if you haven't received the updated if you're not vaccinated, get vaccinated, and that means getting at least one updated booster shot, that relatively new booster. Everybody should have at least one. And next week, we may get some information that will allow people who are at high risk to get a second bivalent booster shot. And then after that, how often we need one really depends on what happens with the virus. If it's something that surges once a year like influenza, an annual booster may be useful. If it's something that's surging twice a year, we may benefit from more than one vaccine per year. But I think at this point, we're fingers crossed, the levels are relatively low. If we get more people, particularly the high-risk people, to get that booster, we'll see fewer people hospitalized and dying, which is really what we want.
All right. Well, thank you. Figured I had you here, and we'd get kind of an update on where we are. But this week again, it's for us. Earth deserves more than a day. So all week long here at Columbia City Theater and on Rainier Avenue Radio, we're broadcasting workshops, panel discussions, films, short stories about environmental justice. Climate justice. And really the thing is, the conversation is the health of Mother Earth. Is kind of what this is all, the buzz that's going on around here. But what I'm hearing is that climate change is a public health issue. Is that right?
Absolutely. I mean, when you look at what climate change causes, it causes extreme weather events and other environmental consequences that lead to health problems. And it also leads to environmental degradation and social effects that they're already impacting our communities across the U.S. and across the world. And we expect to see an increasing frequency of extreme weather events, heat waves, floods, droughts, rising sea levels, declining snowpack our ocean becoming more acidic, more frequent flooding. We're expecting all of this to increase just based on the level of greenhouse gases that are currently out there. And for example, heat waves, we know they cause death and serious illness from heat stroke, heart attacks, renal failure. They can make your pulmonary disease or lung diseases worse. They can make diabetes worse. Our own colleagues at the University of Washington have found an increase in emergency medical calls and hospitalizations and deaths in King County during hot temperatures. And in 2021, we had 30 deaths in King County and over 600 in the greater Pacific Northwest due to that record-breaking heat wave. So climate change is first and foremost a health issue, but it also can cause tremendous societal disruption, cause people to have to leave their homes, lose their belongings, can cause instability with our critical infrastructure like electricity, power generation, our roads and transportation systems. Those are called cascading impacts. But it all boils down to how it affects human health. And like you said, Tony, in Mother Earth, we need to love our mother and start, taking this more seriously at the national level.
And you made some what I'm going to call big picture things that you just talked about, extreme things that are happening with weather. I would like you to connect this in a way that folks are saying, okay, but how does that affect me? When you're talking about a public health issue, these are things that maybe for folks hit a little bit closer to home. And I'm not saying that these extreme, changes in temperature and extreme things that can happen can't affect us here. But can you make that hit home a little more closely? Because when you say a public health COVID, we get public health crisis.
Okay.
Climate change, and I'm not saying it's not, but explain to us why you're saying public health crisis.
Right. Well, if you don't remember that heat wave that I mentioned, that was the deadliest weather-related disaster in Washington state history. And we expect these heat waves to become more frequent, longer in duration, more intense. So we're going to see more of them. But in addition to those heat waves, there are things like droughts, wildfires, and floods. Floods can impact people's health if they have to suddenly move out of their homes or lose their belongings and their possessions. It can cause mold to grow in the home, which can bring on other health problems. You may remember some of the smoke days we've had. The air quality is seriously impacted by climate change due to wildfire smoke, and that causes asthma and other chronic lung diseases like COPD and emphysema to get worse. We can see increasing infections from waterborne diseases that can grow in the warming seawater, and things like insect-transmitted diseases like West Nile virus from mosquitoes and ticks. And then there's just a correlation between mental health and well-being and heat and climate disasters. So there's a variety of body systems that are directly related to these severe weather events and the warming atmosphere that are very serious and are squarely personal and public health problems. They're personal health problems when they affect you and your family and your loved ones. They're public health problems when they affect lots of us. And that's what we're seeing. And you can just look around the country now and see the disasters that are happening, the rainfall that just happened, in Tampa, Florida, over a foot of rain, almost 2 feet in one storm, one night. These are sort of unheard of type of events that impact people's health and their psychological well-being as well.
My guest again is Dr. Jeff Duchin, King County Public Health Officer. You're listening to Street Beat. It's me, Tony B. This is Earth Week for us right here, Monday through Friday. We'll be bringing you conversations. We just earlier today talked to folks from indigenous tribes. When we're talking about this as a public health issue, And I just asked you to kind of break it down a little bit and make it a little bit. But is there something that can be done by an individual? Because this it sounds like what you're talking about to me does not respect the borders of countries or states. And if this is happening, are you suggesting there are things that we need to do as a country that there are, or is it just like, hey, get prepared for this, because what's happening around the rest of the world will ultimately impact what we do here and how we are surviving here in the United States? And where is the U.S. In regards to cleaning up or doing our part to make sure that these emissions and greenhouse gases, our footprint is smaller?
Yeah, those
I know
are
that's a lot, but
really important questions. I mean, that's the crux of it. And then there's two key pieces there. That one is, we have to decrease the greenhouse gas emissions. And the second piece is we have to prepare for the amount of warming that's already happened and the extreme weather events and consequences that are already baked in and that are really can't be reversed for, thousands of years. And then we have to avoid this from getting worse by continuing to raise the global temperature, by continuing to burn fossil fuels and increase our greenhouse gas emissions. So the two main pillars are, decrease greenhouse gas emissions and prepare for what's inevitable based on the amount that we've already contributed to the atmosphere. I would say that the U.S. is not doing enough. No country in the world is doing enough right now. Last year, the greenhouse gas emissions globally were higher than they ever were. And we know that we have to take drastic action to cut our greenhouse gas emissions by 2030 to avoid truly catastrophic impacts of climate change. So internationally, this is an ongoing topic of.
Well, I'm going to stop you right there for a second, because you said 2030, which seems like a long time away, but it's not that long away. Right. And you said to avoid catastrophic.
More catastrophic.
more catastrophic.
Yeah,
and it seems like it's bad now. Yeah. But what is it that we need to do by 2030 to avoid, and what is it that we are hoping to avoid? Again, if we're talking about climate change being a public health crisis.
Well, simply put, we need to stop putting so much greenhouse gas into the atmosphere, which means we need to stop burning so much carbon fuel. So, the energy sector, the food production sector, it's really about clean energy and finding renewable energy sources and transitioning to those as quickly as possible. And governments around the world, I think, and scientists at our own, NOAA, National Oceanic and Atmospheric Administration, and others who have created very good blueprints for us on how to reduce our greenhouse gas emissions and how to cut back on fossil fuel use, can give us sort of pathways that will, so if you cut back by this much, by this date, you can expect to see these consequences. And if you let it go too far above 1.5 degrees warming, which is what the Paris Accord, target was, then you would expect to see even more drastic changes in extreme weather events more frequently. You expect to see higher levels of sea level rise and more severe impacts on things like our ability to grow food, the people being able to live in environments that are no longer hospitable, and there'll be large amounts of people migrating from communities across the world to more hospitable climates that can produce, geopolitical or instability in countries and political unrest. So there's a lot of consequences that are not, you wouldn't think of as just disease related, but are health related. When you think about people needing to pack up and move because they can't grow crops anymore or sustain food where they're living, or it becomes too unbearably hot, or the flooding drives people out. So the number one thing we need to do is to stop burning so much fossil fuel. And it's not a secret on how to do that. It's just the political will at the highest levels of government, and need to figure out how to do it in a way that causes the least amount of disruption in society and accounts for those costs that are going to be incurred in transitioning away from fossil fuel in a fair and equitable way. We know that the communities that have contributed least to this problem are suffering the most from the impacts of climate change across the world.
You know what? And I'm gonna just get that one out of the way before I go to the next question. The folks who are currently low income, those who suffer from the thing, this is who climate change is going to hit the hardest. Is that again correct? Is that a fair statement?
Absolutely. I mean, we know that the health effects of climate change are going to have a greater impact on vulnerable communities we already know are at increased risk for poor health outcomes because of other social and environmental factors, for example, related to structural racism like redlining. All the reasons that we've been talking about social determinants of health and bad health outcomes from cardiovascular disease and diabetes and asthma and infant mortality. Those same factors make the health effects of climate change also more severe in those communities. And that's why this whole concept of climate equity, which is understanding and recognizing the unequal burdens that are made worse by climate change, is important. And that's what we're trying to do, at least locally, and I think hopefully nationally, as we work with our communities to prepare for coping with climate change and limiting the damage that we would otherwise suffer.
I'm being kind of redundant about this because we're trying to create awareness. Some of the things that we're talking about here are not part of the daily conversation that folks are having when it relates to environmental justice and what we're calling climate justice. I was recently in Olympia for a farm workers tribunal, and the conversation was, you talked about this crops, there are places where crops are not going to grow. Food does not come from a grocery store.
Right.
And I know this may not be your wheelhouse, but if this is something that you can talk about to some extent, when you talk about crops and food being unable to grow, and this is a result of environmental injustice and climate, and can you tie that together to, okay, you know what does that mean? My food's going to get more expensive. Food will be unhealthy. Yeah.
Well, I think you summarized it well. I mean, not only will extreme weather like extreme heat make it difficult for people to work, and particularly hard on those agricultural workers and other outdoor workers who produce our food for us, but also can make it more difficult to grow the food, which will mean, okay, maybe that's not such a big deal if you're not growing the food in your neighborhood or in your state or in your region, but it's going to make the food more expensive. And that means people who are already, struggling to buy food are going to have to pay more for it. So there's lots of these indirect effects, as you mentioned, Tony, and I think food's a great example. Agricultural production, and it's also our aquaculture, our fishing industry, and our seafood, which a lot of people depend on for nourishment and livelihood here. That is also damaged by the rising sea level temperatures. So these things can make food not only less plentiful, but also more expensive. And that's a problem in and of itself right there.
I feel like we just got started and it's almost time to go. And I haven't even touched on mental health.
Yeah.
Because but again, let's talk about put in perspective the impact on mental health, and make a connection, if you can, for us with climate change.
Well, particularly, I think we can all relate to the fact that severe weather events, flooding, fires, wildfires, smoke, extreme heat, death, people in your community and your family. These are stressful events, and they they can cause anxiety. They can cause people to become irritable, angry. Increase. It's been shown in domestic violence and suicide and other behavioral health issues with extreme heat and other natural disasters. So, not only does it stress the body, these events, but they stress the mind and the psyche. And the behavioral health and mental health impacts of climate change are real. They're as real as the physical damage and the asthma and the emphysema and the diabetes and the heart attacks. But they're harder to study and to recognize. But we know that these conditions that I mentioned, including depression, aggression, domestic violence, increased use of substances to cope with stress, are linked to extreme weather events and, for example, extreme heat. Wow.
My guest again, Dr. Jeffrey Duchin, King County Public Health Officer. Jeffrey, we're almost out of time here, and I feel like we covered, some of the issues. Again, the point of this is to create awareness. And I got to get a couple more questions. Is there anything that we can do? I'll start with you. You've talked about reducing greenhouse gas, but individually, personally, for folks, is there anything that we can do?
Well, I guess there's on the two fronts. I mean, if you want to help decrease the problem, and you are able to look at your carbon footprint and try and conserve more and burn less fossil fuel in your personal life, that's great, and there's lots of web information on the web, about what I can do. You just Google, what can I do to help with climate change? But I think the more important thing for us is to prepare for, what's going to happen, what we know is going to happen, and what's going to be getting worse. So that would mean, ways to stay safe in extreme heat, and to stay safe when there's wildfire smoke outside, and to keep our community in general safe from the effects of climate change. And we've got a lot of information on our websites, which I'll send to you, Tony, where people can look up, what they can do for each of those things, with respect to how to protect themselves and their family when there's a heat wave or a smoke event. And we can, that way make our community safer, also educate one another. And we have a really, really good King County action plan around climate that's addressing all the different components, including the greenhouse gas emissions, but also strengthening what we call our frontline communities. And the section of the plan is called Sustainable and Resilient Frontline Communities. And those frontline communities are the ones that are more likely to suffer the impacts of climate change because of historical disadvantage, economic, social, educational, all the structural factors that make people to increased risk for poor health outcomes in general. And so we are focusing on working with community, which is an important feature here, to identify what solutions will work best in any given area. And that strategic plan has a community equity climate task force made up of members of your community and other communities around the county that have helped inform how we should prioritize what we do together. And so maybe at another time, we can come back and talk about that plan and how we're working with communities to try to build resilience and preparedness for what we're all inevitably going to experience over the next, during our lifetimes, as climate change marches on.
It's not fair for me to ask you to answer this in 30 seconds. But again, the increased risk, vulnerable populations, where there are already health disparities. What about issues like asthma, cardiac-related issues, diabetes? What can we do if we know that it's coming and we know that there are vulnerable populations, and you're part of this vulnerable population, and this awareness has created interest in you? The things that I just discussed, and I'm sorry to put you under pressure to answer this in 20 seconds, but
well, I think, in 20 seconds, I would say, first of all, get educated. Learn about what you can do, what can be done to decrease your risk, and then try, if you want to get involved. Work with your representatives. Find out it's all public information. Go to the plan, see who your representative is on the climate equity and task force, and get involved. But there are things you can do with respect to your health care now, you're managing your illness now, and there are things you can do to prepare for when the climate emergency, extreme weather event happens that will decrease your risk. But taking care of yourself now, making yourself healthier to the extent that you can, any steps that you can take will always pay off, no matter what the problem is.
All right. Thank you, Dr. Duchin. Our next discussion is going to be about environmental justice across borders. And I did mention that, it's not recognizing state lines and stuff like this. So, but thank you for joining us, Dr. Duchin. We'll probably just have to get you back again, but thank you for coming on and awareing us about this particular issue that we're talking about, climate change as a public health, I'm going to say this, crisis.
Yeah.
Thanks for joining us.
It's great to see you. Thanks for asking me, Tony. Be well.
Take care.